Catch your breath. What happened to you?
So I have two issues. The first one is I had my baby 14 months ago, and during labor, I think they moved my hip out of place. I couldn't walk for like a week afterwards. Like I had to hold on to things to walk, and it's just been hurting ever since. Like it radiates. Like some days it's not bad, and other days it's like I can't even get off the couch. I can't like weight lift or anything.
What?
And I've been adjusted a couple times.
Okay.
It just doesn't, the chiropractors just don't be able to get it, I guess.
So it's always that right hip?
Yeah, it's like, somebody thought it was my SI joint because it's like right in here.
Yep.
This little bone right here and then into this part.
Okay.
It wraps around into like my pelvis.
Okay.
Yeah, so I think because it's my fourth baby, so I know like how you're supposed to feel afterwards. And I kept telling them, they did a bad epidural placement, so I kept telling them, I'm like, I can't move my leg, and the nurse pushed him out of the way and just kind of yanked it up. So, yeah. So I've had this pain, and it's every day. Like some days, like I said, it's just a dull ache, and other days it's 16 ibuprofen later, just trying to get through the day. And then I slept on an air mattress for the hurricanes, and I did something to my shoulder where I couldn't move my shoulder for 2 days.
Okay.
And it's still hurting and like underneath my neck in between my scapulas.
Okay.
On this side. Yeah.
Okay, so obviously the neck, shoulders more recent.
Yeah.
This the
is
14.
months.
Okay,
Yeah.
and this was what?
This is
Milton,
from 2
Helene.
weeks ago.
Yeah.
Helene, I slept on an air mattress for 3 days, and then Milton for a week, and I did something, and it just, this whole section, like it hurts when I turn, like I can feel the tightness in both sides.
Like if you look both ways?
Mm-hmm.
What about?
Looking down, I can feel the tightness. It's like right under, he calls it my hump. It's like right under this little hump right here.
Okay.
I feel it. And it's like both directions it hurts, but this is the side.
Where you're
left side that I couldn't move my arm. It was like stuck like this for 2 days. Every time I leaned back, it was like searing pain.
Oh my gosh.
Yeah.
And you have 4
I
kids?
have 4, yeah. Yeah.
How old?
9, 5, 3, and 1.
Whew.
Yeah.
Whew. Dang. Okay. Dang. All right. Yeah. You got me beat by 1, so. But I'm like right there. I've got 6, 4, and 1.
Okay.
So I know where you're at with the 5 and the 3.
Yeah, they're basically twins.
Yeah. Gosh.
Yeah, so it's been fun, but this one's been the worst of it. I think this is why he had me come in here.
It was because of that right hip.
And
Okay.
then this is just icing on the cake.
Now, how is like?
I can move.
Yeah.
Like today it's not as bad. It's today is just I can feel that there's a pressure or a discomfort. There's something
Yep.
in this section.
In that spot where you point.
Yeah, in this section I can feel that there's something there. But the more I do, like when I try to work out at the gym or if I'm running around too much or up and down too much, it progresses worse, and then I can't sleep at night. Like I can't lay flat. Because it's like I'm doing this all night trying to get that pop sensation.
Yep.
And it never works. So I'm just like, I can't sleep because it's just like a pain and a radiation. And I'm constantly like just kind of pushing on that bone right here, hoping that it does something. And it doesn't. And like heating pads, ice packs, ibuprofen, just kind of rotating those on the worst days.
Okay. And then 4 kids and
not much you can do.
life don't stop. So. I feel for you. I gotcha. Let me have you go face down on the table.
I sleep horribly too, like in a terrible position, so I'm sure that doesn't help at all.
No, probably not. Yeah, right leg is pulling shorter. Right hip is actually a little bit raised up too.
Is this side right?
Yep.
This is the side that hurts.
Yep, all right into there. Let me know if there's any pain or tenderness. Oh, dang, your neck is tight.
Mm-hmm.
You know,
It starts to get a little more sore the lower you go.
and it's getting a little tighter the lower I go. Okay. Oh my gosh. And you said you have gotten adjusted a few times?
Yeah. It just doesn't seem to get right where it's hurting.
Okay.
So that hurts when you push down like that.
Okay.
Mm.
That one?
Yeah.
Okay.
It's all tender when you push on the toes.
So from that, like all that lower. Dang.
Like from you pushing on there, this side's hurting. Like I can feel like a little irritation right here too. Just from pushing right here.
Just from pushing on that? Oh my. Yeah, you know it's not supposed to be like that, right?
Yeah.
Okay.
All that's tender.
Is it really?
It hurts.
How is it on this side?
It hurts too.
Okay. Okay. I'm going to start up top here. There we go. Alright, gonna drop into the middle thoracic here. Ooh, yeah, like one deep one in there. A little bit lower. There we go. Okay. Let me have you sit up on the table, go one leg on each side. How'd that feel?
Painful. It hurts so bad.
Yep, and bring that one up. This is a sitting lumbar adjustment. Actually, scoot back just a tiny bit. Perfect. Yep. I'm going to rotate you that way. Dang. There we go. I would say that was needed. Bring your arms up again. Wow. Heck yeah. How did that feel?
Like it hurts right here now. pinching pain.
Okay.
Right in this one. Like, I can feel it in my ankle.
I got that. Oh my gosh, this is like so tight up here. What in the world?
It's so bad.
There hasn't been someone today that's needed this as much as you right now. Oh my gosh.
I heard something.
I know, right?
Yeah.
All right, let's check this shoulder. Good there.
I had terrible posture.
Good. Shoulders are both good there.
Even that hurts.
Just that. Oh my gosh. And then let me have you go face down again for me. Better, but still that little bit short there on that right side. How's it feeling when I'm pushing in?
A little better than the first time.
Okay. But still obviously not like fully back, but better.
I still feel like pressure, all this stuff. Like, it's almost right here. Like, I don't know what this is.
Okay.
It's like right in his area right here.
Okay. And then is that still feeling it like wrap around?
Well, not today, but in the beginning that used to wrap right into my pelvis bone. Now it's just kind of like
There.
isolated right under whatever this is, this section.
Okay.
Yeah, it's like right there.
Okay.
I don't know what that is.
All right, I'm gonna stabilize right here. I want you to raise your right leg up as high as you can. Any pain with that?
No, just weak.
Okay. Now let that one rest. Do the left one for me. Any pain with that? Okay.
I mean, I feel a little pinching when I raise it like this, right here.
Okay. Cross your left foot over your right foot for me. balanced again. Heck yeah. That is what we needed. And just relax your legs. Bring your knees, yeah, go up like that. Push out with your knees to my hands. Good, and relax. Squeeze in with your legs. Good, and relax. So I want you to squeeze in. I'm gonna pull on, okay? Go. Squeeze in. Good. Yeah, I wanted to check the pelvis there. It was good. Every now and then, just because with women and childbirth, you can get like a little pop right in the pubic symphysis right up front, but I figured I'd check it at least. If it needed to go, it would have been pop.
Yeah.
Any kind of decompression?
I don't think so. Maybe the towel one?
Okay.
Like if they put the towel around your neck and do this?
Yep. Catch your breath. What did you feel?
Like it all popped. Ow. Sounded like a glow stick in my head.
That's just how compressed your body has been. For it to crack like a glow stick like that. Here, let me sit you up. How are you feeling?
Sore, but good.
Good.
Yeah, it doesn't hurt as much right here anymore.
Okay.
Feels better, yeah.
How's even just like a little bit of the movement?
Yeah.
Like I know obviously with just getting Y strap like that, it's intense. Like you gotta give it a little bit of time for the muscles to relax down, but
Yeah, but it feels better.
good. How is lower feeling too?
It feels very sore right now. It's hard to pinpoint whether there's pressure or not, just because
Yeah.
all the popping. But I think it feels better. It's like hard to tell. My shoulder feels better though. This part feels better.
Good.
Yeah. All of this feels better right in here.
Okay.
Yeah, like all this feels better. This is just really sore right now. Really sore.
Well, I went through and had to get those, even the drops in, so the drops were on the sacrum itself.
Mm-hmm.
That when you raise that left leg up, I know you could, granted, you could do both of them actually really well. Both legs went up,
Mm-hmm.
but when you did the left one, you felt that little bit of like pain on
Mm-hmm.
that spot on the right. Just tells me that that sacrum was a little bit pointed off to the right. So the drop, I was torquing the sacrum back down, which
Mm-hmm.
on
I
your
can
body,
feel that.
Like it's it. Like I don't hold back, especially on the drops. I know, like people watching, you can't tell the force that I'm doing in that area, but you feeling it, I don't hold back. I get things to move back when I need to.
Yeah, like I feel like it's more aligned right now. Like these two little pieces, I feel like they're more like in alignment, where before this one fell off.
Yeah, because I know you kept going to that right side,
Right here.
right
This
at,
bone.
Yeah, basically right on the inside part of the SI joint.
Yeah.
Like that little.
Yes.
And you were kind of like on that inside part of it, everywhere.
Now they kind of feel more in alignment.
Good.
It doesn't feel as sticking out, I guess. Like I can't like stick my finger underneath it like I could before.
Good.
So,
Okay.
yeah.
All right, so we are gonna do scraping, a little bit of laser, and then one more of the Y strap after. Make sure everything is where it needs to be.
Okay.
Ready?
Yeah.
Yeah, sleep on my back, but it's painful to sleep on my back. But yeah, sure thing. No, I can't stand, like, at times some of the recommendations and whatnot, and then just where it jumps to.
Well, the best part is you go in, you tell them you're hurt after you have a baby, and they're like, yeah, you just had a baby, get over it. And I'm like, well, it's my fourth, so I'm pretty sure I know what it's supposed to feel like, but sure. So then I go in for my 6-week appointment, and I'm like, which is actually my 8-week, because you can't get in.
Yep.
And I'm like, hey, my hip is still messed up, like pretty bad. And they're like, well, you just had a baby, call us if it doesn't get any better. And then you call, and they're like, yeah, we don't handle that, you need to call your primary. So then you go and see your primary at 12, 14 weeks postpartum, and he's like, well, why didn't you come in sooner? Well, because everyone told me you just had a baby, get over it. So it's like, and then his recommendation was, here's a steroid. Oh.
Yeah, to be honest, I feel like medical doctors are, I mean, if you have a traumatic injury, car accident, something crazy, you break a bone, whatnot, 100%, that's exactly where you need to go, you know. Don't go to a physical therapist or a chiropractor. But when it comes to muscle ache, pains, things like that, sciatica, neck pain, like a nerve. A medical doctor, they're taught and trained for medication. They know what to give you to cover up that pain, but that's all they, you know, there's a time and a place for every profession out there.
I feel like they just mask it, just try to mask the pain, and then with something like medications and stuff. So I don't want to do all
Which
that.
I won't be on. I don't want to be on medication.
Well, no, and considering you have 4 kids, I mean.
I have lupus too, so
Okay.
it's like I don't want to be on anything that could cause my body to have a reaction, and then I need another medication for the reaction that the first medication gave me, and then that has an issue, so then I need a third medication.
It sounds like a typical commercial.
Yeah, and then you're in liver and kidney failure, and it's just like they're like, oh, I don't understand how your liver went bad at 40. Well, you have me on 80 different medications.
Yep.
Like that's how my liver went bad by 40. They tried to put me on a medication that would make me go blind in 5 years.
Are you?
I'm not even kidding. They even tell you in the doctor's office you have to get an eye exam every year because it deteriorates your eye, and we need to know how fast your eyesight's deteriorating. And it was for blood clots, and I've never had a blood clot.
So, stay blind. You know, get
blind by
yeah.
30, 38 with 4 children.
It's like you said, it's like the commercials.
Yeah.
Oh my.
You might die.
Yeah.
Yeah.
If you are experiencing suicidal thoughts or blah blah blah,
then we'll give you an antidepressant that causes you to have low libido, and then we'll give you another medication for the libido, and then another medication for the stomach issues that you get from the libido medication. So at the end of the day, you still don't want to do anything because you're sick.
pharmaceutical companies making a heck ton of money though.
Not us.
But no, that honestly, that's why the chiropractic, physical therapist, acupuncture, that's why a lot of our professions aren't really looked at the best of light, because guess what? We're not prescribing, we're not making any other profession money is the kicker. And that's why that we're not making big pharma money, we're not making insurance companies money. We're not doing much anything for any other people except getting the patient better. And God forbid do that one, huh?
That way we don't need them.
But you'd think the insurance companies wouldn't mind getting their patients better because it's less they have to pay out. Like once we meet our $2,500 out of pocket, I don't pay anything the rest of the year. So if I'm super sick, the insurance company's forking up all that money.
Yeah.
So you would think that they would want you to be somewhat healthy.
Yeah, you would think.
It's a business.
It is.
Become a vampire.
Exactly. Nothing wrong with that, huh?
Wouldn't mind it. There's less people at night. This side hurts less than the other side.
Did it?
Yeah. It still hurts, so it is not as bad. I can actually like talk through this one.
Now with the lupus, any dietary changes, anything like that?
Well,
or anything to avoid?
Interesting, fun story. I had my third daughter, or my third kid, and I had really bad pain in underneath like my right breast and into my back. And I kept telling everybody, and they kept saying, "You're fine." It turned out I was in liver and kidney failure because my gallbladder had gotten so infected that it infected the entire train down and shut down my liver and my kidney and my pancreas. And I was looking at him and I'm like, I have 103 fever and I'm throwing up. I need to go to the emergency room. And we went and they were like, yeah, your gallbladder looks like a hacky sack and everything's infected all the way down. And no one listened to me. They just kept saying, "Oh, you just had a baby. You know, your back hurts because you just had a baby." And I mean, I kept telling them, like, my back hurts because that's where it is. You know, it radiates around. And the nurse in the ER was the first person to be like, "Do you have a gallbladder?" And I was like, "Yeah." But I'm here for back pain. And then the doctor came in and said, "We have a direct admit to the other hospital. You're being put in for emergency surgery. You're almost septic. Your liver numbers are 1,800, and they're supposed to be 80.
Yep.
And I was like, "I think you have the wrong room, lady. Like, you're in the wrong." And she was like, "No, honey, you're dying. Like, we need to get you into surgery." And I had to have 2 surgeries to stabilize my liver. Like they had to clean out all the infection, and then they had to take out my gallbladder. I was in the hospital for a week. So then my primary care was like, "Yeah, that shouldn't happen." And then he ran numbers and that's when we found out I had lupus. So we don't know if I lost it because of the pregnancy or if it was lupus related.
Okay.
So it was just like an interesting, fun story. And so ever since then, like I have dietary issues now because I don't have a gallbladder.
Yep.
So I can't have
Yep.
dairy or butter or cheese. I mean, I do, but then it hurts.
Yep.
Like, I'm throwing up for 2 days
Mhm.
afterwards. But that's, I mean, besides that, I'm sure I probably should be eating healthier. But everything's kind of works the way that it does.
Yep.
Yeah, but they kept telling me, one guy told me an ARNP, which there's nothing against ARNPs, but he told me taking ibuprofen will kill my baby because I'm breastfeeding, and if I continue to do it, it's going to kill my baby, and then prescribed me 2 narcotics and sent me to a spine doctor.
Oh.
Didn't even ask about my gallbladder, nothing.
Oh.
Yeah.
At least you got 2 narcotics, huh? That's gonna be great for the baby.
Yeah, but ibuprofen will kill my baby. Yeah, and he said it. And then gives me 2 very strong narcotics.
Oh.
And then I told them I'm not paying my copay and I'm never coming back and not to contact me ever again because this is just ridiculous.
Wow.
Yeah. And then I saw another chiro at that time and he addressed me a couple times and said, I think it's something inside. I don't think it's bone related. And he was the only one that like mentioned finding a good primary care.
Wow.
Yeah.
Yeah, we thought it was your back though.
Yeah, because when I labored sitting like I am right now. They didn't lay me down.
Oh, really? Okay.
I labored with my back arched because she was coming before the doctor could get in the room and they didn't lay me down. So I delivered sitting up basically.
Okay.
So I thought maybe from arching my back I had done something right here. I had done something from arching my back during delivery. And so I was like, it's my back. And they're like, your back is fine. It was a fun time. Turns out I was actually dying over the course of 3 months.
Slowly dying.
Yeah, they wouldn't even let me have water in the emergency room. They're like, if you drink water, you will go septic, like it's going to rupture. They wouldn't even give me ice chips or anything.
Oh my God.
Yeah, it was a crazy time.
Wow, yeah,
Yeah, it was COVID.
Oh, and during that time too?
I wasn't able to go in there for a lot of the time.
He couldn't come in to see me before or after surgery. He was only allowed like 2 hours a day.
And then how long after was that with giving birth?
3 months, a little less.
Were you able to see your baby? Or?
No, they wouldn't let him bring the kids in to see me. I had to pump and dump for a week.
Oh my gosh.
Because I was on such strong narcotics
Yeah,
after
you
the
couldn't.
surgeries, you know. I was barely awake to pump too. So, yeah, I didn't see her for like a week.
Oh
He
my
couldn't
God.
bring her in or anything.
How those times have changed the course of the entire world.
Mm-hmm. Well, she was my 3rd at that time, so we already knew the difference between like a normal and the new normal, I guess.
Yeah.
So, but it was crazy times.
Yeah.
Yeah.
Oh.
So I'm a non-compliant patient, but I feel like that's worked to my advantage because otherwise I'd be on a medicine that makes me blind for blood clots that I don't have.
I know. Come on.
Yeah.
I don't know how things get even passed. Like, I mean, granted, I know like Big Pharma and whatnot, they run all the agencies that do the testing, the FDA, like none of that. It's all, literally, it's all BS out there. And it's sad. You know, a lot of the cancer treatments, like it's funny, I get like cancer patients in, and their things to avoid and whatnot are then listed as like things to eat and like through the American Cancer Association. Like I'm like looking at all this, it's like any big publicly funded thing out there is literally just trying to keep you sicker and sicker.
Yeah, he found you on YouTube and he was like, we need to see this guy.
I just happened to run across it, and then my brother was like, oh yeah, I don't know if he went here or knows you, I don't know.
Yeah.
But he mentioned you and some other guy. I was like, oh, I've seen you on YouTube.
Yes. David, he said, oh yeah, I know who this guy is. So.
sit right here again. And come on back. Good.
I felt that one go farther down.
Good. And I even actually went lighter on that second pull than I did the first one. Where'd you feel that one down to?
All the way down.
Oh, okay.
Oh, I feel like I got the wind knocked out of me.
Yep, that's it's not the right feeling that everyone will say.
I feel it in my hip bones.
Got it.
Like all the way down.
All the way down. Yeah, just rest. Well, I'm glad that one did go all the way
That
down.
one went all the way. The other one didn't go all the way down. This one went all the way down. Like I feel it in those little dimples way down here. Oh. It's a weird sensation.
Right? Yeah, not something you feel every day, that's for sure. It's like first time going to the gym in a long time, like that lactic acid type. Like it'll be like, oh my gosh, I'm sore, but
That side still hurts so bad.
yeah, like the almost like a good sore. It's gonna suck, but
No, you pushing on that still hurts.
Okay.
Oh God, yeah. That tendon is still sore.
with that wall, it just went through with all the scraping.
See, this side doesn't feel as sore anymore. This actually feels kind of good.
Okay.
But this side,
You were
it
feeling
still hurts. Like that all still hurts.
all still hurts.
Mm-hmm. What's the aftercare? Just lots of water?
Lots of water. They got ibuprofen, just probably maybe today, tomorrow.
Okay.
I'll always say ice over heat.
Okay.
So if you do a little icing today, and typically in about a day or 2 days, all that soreness will go away. Like even in like 20, 30 minutes from now, you'll notice a lot of that will even go away and you'll be feeling that much better. But yeah, it's literally, for you, it'll probably be about a day to 2 days until you're like feeling the best as you should be.
Okay.
But yeah, how is?
It's good, yeah. My upper back feels a lot better.
Good.
Like that spot up here, I feel like this is smaller even. Like you should feel it. Like he always says, this sticks out right here. I feel like it's smaller.
With the decompression, yeah, it'll pull it straighter for
Yeah,
sure.
it's smaller. I feel a lot of pressure, I guess, or like soreness right in here. So hopefully once that goes down, then I'll be able to really tell a major difference.
Yeah.
Yeah, right now it's just sore from all the movement.
Oh,
It was a lot of movement, I'm sure. Yeah.
I'm glad this
Yeah.
you're already noticing.
Yeah, this doesn't hurt at all anymore. Like those right here in the scapula doesn't hurt anymore.
How's moving, bending, turning? Things
Yeah.
Like that?
I mean, all right here is
Just a sore.
sore, yeah. But it doesn't feel like the pinching right in here.
Good.
Yeah, it feels better.
Yeah, rest, relax, a lot of water, a little ibuprofen, just to kind of help flush that inflammation.
Yeah, all the
and
inflammation
everything
out.
but
That's crazy.
this is what
Yeah.
your body had actually needed.
Was it a lot?